Gynecologist, what is the most horrible thing you have ever seen? A gynecologist is in touch. Sometimes I come across unpleasant cases when a girl walks around for days, weeks with the same tampon. Necrotic cancer of the vagina also looks so-so, but this is not even close to the most horrible case in my life. Once, a 19-year-old girl came to our clinic and complained that she had a hairspray cap stuck in her vagina. Well, that's not a problem, I thought naively. But the catch was that she had put it there at the age of 15. That is, 4 years ago. She did not explain the motivation for this action to us, but it was clear that she was very ashamed. Even before she undressed, one could feel a simply terrible smell, which became even much worse when I began to study the problem. The lid was inserted with the edge upwards, and it was evident that over the 4 years it had become well overgrown with vaginal tissue. The difficulty of removal was further complicated by the fact that this lid had pierced her bladder and rectum. In order to get it, it was necessary to perform several extensive operations. I'm not a gynecologist, but I know someone who recently had a hysterectomy, removal of the uterus. So this girl had stitches in her vagina that needed to heal, but she was so eager to get back to sexual activity that she couldn't resist and broke down, resulting in a thin intestine falling out of her vagina. They told me everything in such detail that I think I will never be able to eat minced meat again. According to the girl herself, when she was going to the emergency surgery, she felt the intestine lying on her leg and pulsating. How do I delete someone else's comment here? I had a friend in high school who was terrified of going to the gynecologist. When she finally decided to go for her first pap smear, she was so nervous that she clamped down on the doctor's legs like a vice. According to her, it took some time before she could relax and release the doctor. It was extremely awkward. Now, of course, she laughs at the situation, but her shyness about her female organs has not gone away. She doesn't even like using tampons. I'm a medical student. Once I signed up to be an assistant for a hysterectomy, uterus removal. When we were going into the surgery, we were told that there was a small ovarian cancer, but it turned out that everything was much worse. All the patient's insides were in metastases, so we spent 13 hours just reducing their volume, although the whole operation should have taken about 3 hours. At some stages, we were helped by guys from general and vascular surgery. We replaced half the volume of the patient's blood. After all that she experienced, she was very unwell. She had a long and difficult post-operative period, but in the end, she somehow recovered and returned home to her family. For all of us, it was a very exhausting case, but the patient and her family turned out to be just wonderful people, so we were honored to help them. I'm not a gynecologist, but I sometimes perform examinations. Once I removed a tampon that had been inside for at least a month. What's most interesting, the girl had been having sex all this time. The smell was simply hellish. When she left, it took several more hours to air out the room. We wandered around the clinic all this time and thought about how not to throw up. My dad told me about a woman who had a severe heroin addiction. For some unknown reason, she once decided to get creative and injected herself in the labia, which led to gangrene. I think the game wasn't worth the candle. I'm a bit late with the answer, but still, I'm a medical student. In a few weeks, I'll become a full-fledged doctor. True, not quite a gynecologist. When I was doing an internship in gynecology, I was sent to examine a young lady. While I was preparing for the examination, the smell in the room was so bad that I started thinking that I was waiting for the worst bacterial vaginosis I had ever seen. I climb inside, start examining everything, but I don't see any unusual discharge. Strange. I start moving back, and I feel that the further I move back, the stronger the smell. It turned out that her feet just stank terribly. I highly recommend everyone to read Dr. Lissa Rankin's book, What's Up Down There? There is a section in which she writes about the most terrible cases in her entire career. For example, about how she found larvae, money, etc. But these are just flowers. The coolest case was about a woman who grew potatoes out of her vagina. Check it out. Wait, what? So, a woman, as a contraceptive measure, decided to insert a potato into herself, and since potatoes really love warm, dark, and damp spaces, it began to grow actively, and as a result, potato sprouts were hanging out of her vagina. My story is not about vaginas, but about boobs, but it is no less disgusting. When I was in high school, I joined a student organization that sent students to internships. I decided to go help at the emergency room. Once, a very heavy woman is brought to us. The complaint is chest pain. Everyone feels that an extremely terrible smell is coming from her, so the doctor decides that she should be washed and examined. He washes her, lifts one of the breasts, and such a stench starts coming from there that we all almost lost consciousness. There was a colorless scab under the breast. The doctor washes it off, a crust comes off of it, and a small hole is exposed, from which cockroaches start crawling out. Most likely she had eggs laid in the fold under her breast, and when they hatched, the cockroaches could not find a way out, so they had to gnaw their way to salvation. My mom had a story that I think is the most disgusting of all the hospital stories I've ever heard. Once a patient in her 50s came to them, very fat, 227 kilograms. She comes in and says that her husband, during lovemaking, complained about some strange smell. But the point is that this smell was felt not only by her husband, but by the whole hospital. Anyway, I don't remember all the details, but in the end, it turned out that her whole vagina was in necrosis. Surgical intervention was required, but it did not save her. She soon died. The best part of this story is that her husband felt this hellish smell first and even during sex. I'm not a gynecologist, but I've also seen a lot of awful stuff. 1. I saw a woman with vaginal cancer. Then I saw what happened to her after a complete removal of the vagina and cervix. The sight is not very pleasant. I can't exactly describe all the procedures performed because I was a very young student at the time. But in the end, only a large hollow hole remained from the former organs from which something was dripping. The poor woman was so heartbroken that she begged her husband to leave her because, quote, "After this you will never be able to love me." But he turned out to be a great guy. He was always near her bed, held her hand, comforted her, and nourished her with love. It was clear that the guy just adored her. 2. A 220-kilogram lady with paralysis of the lower extremities was admitted to us. She had a giant ulcer and necrotizing fasciitis, which destroyed everything that was in the area of the genitals and buttocks. There were erosions in the rectum. We realized this because feces were flowing out of several areas of the damaged surface. When the doctors asked us to take a urine test from her, it turned out that she no longer had a bladder as such, and no vagina either. It was decided to try to somehow patch the wound. The 6 of us somehow turned her on her side and, in fact, began to push a lot of gauze into the giant hole, hoping that she would not shit during the procedure. She died very quickly. In such cases, we are powerless. I feel so sorry for the first girl. I hope she's happy now. I feel sorry for all the people in this thread, including the readers. I'm not a gynecologist, but I've had a defect since birth that I didn't pay attention to until I started using tampons. The thing is, I developed a septum, which caused me to have not 1 hole, but 2. And I realized that I had a problem only when I once tried unsuccessfully to pull a tampon out of myself. I inserted it through 1 hole and then tried to get it out through another, smaller one. That's where it got stuck. It was incredibly painful, but I couldn't do anything about it. Fortunately, this happened when my mother was nearby. She thought I was just an idiot who couldn't get a tampon out, but then she saw what was wrong and took me to gynecology. I had surgery and now I have no problems. I'm not a gynecologist, but while working in the emergency room, I also saw one interesting case. An elderly woman was brought in after a fall. We start looking at her. She has a giant vaginal cancer. Her pelvis looked as if 2/3 of a soccer ball had been glued to it. The tumor was so big that it was pressing on the nerves of her left leg and preventing blood flow, which is why, in fact, she fell. Any idea what happened to her after that? No. When I left there, they were still working on her. I hope they ended up sending her to a hospice. It's just that with such a tumor at 80 years old, it makes no sense to do either chemo or radiation or surgery. I work as a nurse in the gynecological department. Oddly enough, I rarely encounter any terrible stuff. Our women are quite scrupulous about their vaginas, and in general, the vagina is a very hardy organ. It can withstand even the most improper handling. The most terrible case was when a woman came to us for a hysterectomy. At the beginning of the operation, the surgeon made a mistake and accidentally cut her intestine. It was decided to stop the operation until the intestine healed, but everything went wrong, and it did not heal. In general, soon the cut of the intestine grew together with the post-operative wound on the abdomen and formed a fistula through which feces came out. And a wound through which feces come out is not so easy to heal, you know. As a result, the woman spent 9 months in the hospital, survived 1 million infections, and in the end, it seems she died. Ruptures of the wound, complex dressings that lasted for hours, etc. At one point, her fecal wound was so big that it could easily fit 2 of my fists. It all ended with her getting a permanent colostomy, a bag for poop, and according to the latest information, they never removed her uterus. Well, thanks to your stories, I will never again be ashamed of the fact that I did not shave my legs or bikini area before going to the gynecologist. A couple of years ago, my buddy was an intern in gynecology. Once, a young patient came to them with 2 complaints. 1, she can't get pregnant. 2, she has constant diarrhea. The gynecologist asks, "How often do you have anal sex?" She replies, "Always." It turned out that her boyfriend convinced her that it is easier to get pregnant through the back than through the front, so she asked him to only fuck her from behind. The story of my gynecologist colleague. A girl came for an examination, climbs onto the chair. My colleague inserts his fingers into her cervix. At this moment, a brilliant question comes to her mind. Have you ever thought that this is somewhat similar to stuffing a turkey? My colleague, trying to keep a straight face, "No, but now I will think about it every Thanksgiving." The patient laughed, then looked my buddy straight in the eye, and clucked like a turkey while my buddy's fingers were still inside her. My favorite Thanksgiving story. My grandmother worked as a nurse in the gynecology department for 20 years. One day, she stormed into the house furious and yelled, "If I have to look at someone's vagina one more time in my life, I'm going to kill someone," while simultaneously smashing all the dishes in the house. The next day, she quit. My mom works as a gynecologist assistant, so I've heard a lot of different stories. Once, a woman came into their office who reeked like a garbage dump. It turned out that she had been walking around in the same underwear for about 2 months. They were dark yellow-brown in color. Apparently, no one told her that you need to wipe your ass. I had a very strange first visit to the gynecologist. I was very nervous, and I got some old lady who clearly noticed it. To somehow defuse the situation, she says to me, "Well, you're lucky that you didn't get to a male gynecologist. They don't have fingers, but healthy sausages," after which she inserted her decrepit grandmother's fingers into me. Thank you so much for watching. Gynecologists can write in the comments what is the most horrible thing you have ever seen. And don't forget to check out our other videos. And by the way, bon appetit, bye!